wearable device market is one of the fastest developing market in 2018, and the market size is increased by the 27%, and the shipping volume is around 172 millions. And in those shipped items, 30% are the smartwatches. With the advancement of the technology, wearable devices are able to check people's heart rate and blood pressure, and FDA approved that kind of the devices apply on the human body. It means the devices are able to get the data from the real human, and the data will be passed to the data center, and the scientist will go through those data and quantify the people's health condition. Over the world, the first wearable devices is created in Japan called Manpoki. The purpose of that devices is to help the people measure how many steps they walked a day, and it encourages people walk over 10,000 steps every day and help people keeping health. And recently, the devices are able to track more and more data. Like in the future, the device might be able to check the blood, check the diabetes. So we have to face to one problem, is the data privacy. What kind of people should able to access the data? And how should we protect the devices do not get hacked? And what should we do if the devices get hacked? And those problems are need to think about. And moreover, we need to realize that still a lot of people cannot afford wearable devices. So for them, it's not fair that some people have the wearable devices get the better health treat.
So today I'll be discussing the data and privacy part in health informatics, and basically how it revolves around health technology. So digital health technology, it's able to provide individuals and clinical care teams with often missed data. And often when these things are made, they usually revolve around a model that we call the model of PI, so personal informatics. So it's usually a 5-step thing: preparation, collection, integration, reflection, and action. So preparation as to the how and why we're creating this data, this technology. Collection, such as the measures that we are taking, what are we taking, whether we're analyzing behavior or blood pressure or glucose levels. And then integration, so collect the data that's collected, piecing it together and trying to look for those patterns. And then reflecting, so looking upon basically the connections that were made in integration and trying to see how those connect with diseases per se. And then action, so taking action upon what diseases and like what treatment plans to take upon making these discoveries. And so of course data safety standards and accuracy of these measurements is a big thing that we need to think about when creating these health technologies, basically because most of like the apps that are already in the store were not all developed with the purpose of saving a life that's a potential risk of disease and death, but mainly just for fun. So upon this, we need to basically improve the data collection and the accuracy of the measurements, just so we can have so we can quantify the data better and optimize it to fit the needs of both the patient and the clinician. And of course, now that we're entering the data, an era where we want to promote digital health technology, we also want to remind ourselves about how privacy will be kept. So between both the tech companies, the clinical care teams, and the patients. So I think it would be best to basically enforce these regulations to the tech companies by government regulators such as HIPAA, because we always want to make sure we maximize the benefit and minimize the harm.
While some people believe that having a tracker where users need to log in all their data regularly is enough, I think that this approach doesn't necessarily work for everyone. One main issue is that it requires a lot of motivation from the user to load in all the information on a regular basis over long periods of time. Some people can't stay motivated enough to keep using trackers for more than a few months. One way to counter it is making a competition between friends. For example, there are pre-existing applications that allow you to add your friends' accounts so you can see their progress. This gives the user motivation to perform better and check the app more. However, one of the downsides to making these actions to a competition is that it can encourage people to push past their limits, hurting themselves, rather than maintaining a healthy lifestyle. So while having other forms of motivation to keep people to log in is important, there needs to be a balance. One example that I appreciate from 2009 to 2010, when Pokemon Heart Gold and Soul Silver came out, Game Freak attached this device to game copies called a Pokewalker, which is essentially a Pokeball-shaped pedometer that was just really tiny. It was able to interact with the game in multiple ways. This device records your steps, and the daily amount of steps taken can influence what kind of rewards were earned in-game. You could even transfer one of your Pokemon from the game copy into the walker, where one step would earn 1 experience point. Having a form of motivation to engage with the tracker other than just making it competitive is very effective. Iterations of this kind of model would encourage people who do not want to use trackers to try them like they would any other kind of game. Having a health tracker software executed in a mobile game framing would encourage certain demographics in ways that conventional health apps could not. Just a food for thought.